Hi, my name is Dr. Donna Ryan, and I'm Professor Emerita at the Pennington Biomedical Research Center in Baton Rouge, Louisiana. Welcome to this podcast episode, How Living with Obesity or Overweight Can Affect Your Health. This is part of a 6-episode podcast series called Finding the Weight Loss Plan for You. Today, I'm speaking with Dr. Amanda Velazquez. Dr. Velazquez, can you tell us a little bit about yourself and your work with weight and health?
Sure. Thanks so much for having me, Dr. Ryan. My name is Amanda Velazquez. I'm an obesity medicine and nutrition specialist, and I am the director of obesity medicine at Cedars-Sinai's Center for Weight Management and Metabolic Health. And we're working with people who are living with obesity or overweight and ways to positively impact their health.
That's great, because as we know, many Americans have challenges with their weight. But not everyone might know about being obese or overweight, how it may happen, and how your weight can affect your health. So for this episode, we can start by letting everyone know about the science and biology behind your weight. Dr. Velazquez, can you talk a little bit about that?
Of course. First off, I'd like to say that it's very important to understand that obesity is a health condition. Ultimately, it's a very complex disease. Weight is more than just diet and exercise, which I think is often a common misperception that people think it's very simple. There are numerous factors that will end up playing into why an individual is living with obesity or with overweight. And those factors are different for each person. Essentially, everyone has their own story. And we know that genetics plays a significant role. And ultimately, in a nutshell, it's a combination of how our environment interacts with our genes. And that is what really is playing the major role in why one evolves into developing extra body weight. So, for instance, a person might be having a strong genetic history and was living with overweight as a child, which then sets the stage for them to be living with overweight as an adolescent and then ultimately as an adult. So, several factors that can contribute are going to lead for a person to get hits to their system, is what I like to call it, that makes the body want to evolve to be at a higher weight, or what we call a higher set point. So this can be different hits to the system in the form of stress, trauma, weight after pregnancy that we see so commonly for women, individuals who are having sleep disturbances, working second shift, working third shift, and other factors that can lead to weight dysregulation. So these hits to the system, ultimately, they lead to an inflammation cascade that we see in our fat cells, which are also called adipocytes. And once that begins, it's really difficult for that inflammation cascade to return and for our body to be back in sync with our energy regulation. And we know that obesity is a chronic, long-lasting inflammatory condition. So exposure to these events, experiences, and factors in the environment, especially if our genetics are predisposing us, can lead to inflammation in your body, which increases the body's desire essentially to store fat. So when they say that energy in equals energy out, all you have to do is eat less, move more. That's not the case. We all know that. Otherwise, we wouldn't have individuals dealing with extra body weight, with so many of us affected in the US. The equation no longer applies to the body when this dysregulation is happening.
You know, I really like the way you explained how inflammation in body fat really produces a lot of ill health. And it's an inflammation cascade. It's inflammation that tends to get worse and worse instead of getting better. I think you've explained it so well, Dr. Velazquez. And it's a good way to think about overweight and obesity, because many times people want to blame themselves and they want to just try harder to lose weight. But it's really not about willpower, is it? It's about your body's biology. And we also know that in losing weight, we really need to focus on overall health. It's not really so much how we look or how many pounds and inches we need to lose, but it's really about trying to improve our overall health. And weight loss can be a good pathway to improving health. We also need to start talking about body mass index, or BMI. BMI is calculated from your height and your weight, and it's part of your electronic health record at every health visit. Generally speaking, when an adult has a BMI of 25 to 29.9, it's considered overweight. And when the BMI is 30 or higher, it's considered obesity. But look, BMI is only a measure of body size. What other factors are important in making a clinical diagnosis of obesity, Dr. Velazquez?
Thanks for that question, Dr. Ryan. I think that's a good point, and we definitely use BMI as a metric in our medical system. That's always how it's been for decades now. So what I would say is that there are other metrics that we also like to look at, which we call in medicine biomarkers, and we're aiming to look at not only the weight or the number that we see on the scale, we also want to appreciate that waist circumference is a factor and a biomarker that we're looking at. Exercise tolerance, which means how much can you exercise? Can you do the activities that you want to do? Your energy levels when you wake up. Do you feel like you have the energy that you want for the day to be able to take on all the tasks ahead? And also seeing improvement in other conditions that are weight related. So your hemoglobin A1C, which is a reflection of your blood sugar levels, and your blood pressure, we want to know, is that improving if you're dealing with, for example, high blood pressure or hypertension. And then finally, I typically will review with patients the importance of their general just functionality. Can they get up and down out of a chair? Can they sit comfortably in a chair? Can they walk without feeling out of breath to do their normal day-to-day tasks in their home or at work? So these are the type of things that we look at in addition to body mass index.
And many people just focus on changing their body size, but it's not just about that, because different amounts of weight loss are needed to improve different aspects of one's health. And all that can change as you get older and at different stages of your life. The pattern of weight gain can also change as you get older and at different stages of your life. For example, after age 70, we usually see weight begin to stabilize and weight gain becomes less of a problem. It really has to do with aging. Your overall fitness is also going to evolve. And again, we worry about maintaining fitness with advanced aging. So your health is going to be impacted by the amount of body fat, where that body fat is located, and your fitness level. It's not really so much about how you look. Dr. Velazquez, tell us about how one's weight can affect one's health and how other health conditions can be related to your weight.
Yes. So people who are living with obesity or overweight compared to healthy individuals are at increased risk for numerous medical conditions. Both you and I know that very well, Dr. Ryan, from our practices. And this includes high blood pressure, high cholesterol, heart disease, stroke, sleep apnea, breathing problems, and certain types of cancers, arthritis, joint pains, and diabetes. Diabetes is a major one that I want to talk about because that one is very much affecting individuals hand in hand with their weight, because the processes or the underlying mechanisms that lead to diabetes are very similar to what's happening in our body with developing extra body weight. We know that a process called lipotoxicity, or a process that is essentially inflammation in our fat cells, starts to affect our insulin. And insulin is a major hormone in the body that is helping to regulate our blood sugars. So with that, we see that the body is no longer able to regulate the sugars at appropriate levels. And as a result, over time, this can lead to high sugars, which is a form of diabetes. So what we want to try to do is help individuals to improve their weight to ultimately improve these medical conditions. That's how we help them to set goals and understand what percentage of weight they may want to lose in order to improve those medical conditions or prevent those. And we also see a lot, besides of diabetes, is high blood pressure. So with high blood pressure, we know it can affect your blood vessels. And again, inflammation is at play here. You can see that there is a theme here, and that ultimately, there is risk then for heart disease if an individual is with high blood pressure. So these are important considerations for individuals living with overweight or obesity, because we want to be able to help them to live the healthiest life they can and to its fullest. And we want to help to improve these medical conditions and or prevent them.
That's right, Dr. Velazquez. It's so important to understand that link between diabetes, type 2 diabetes, and being overweight. The good news is that weight loss has just as powerful a link, and weight loss really results in a lot of improvement in diabetes. But obesity is also related to increased risk for depression and many other conditions, such as infertility, and how we feel and how we function. So it's important to mention that being overweight and obesity can greatly impact your quality of life. One thing that happened in the COVID epidemic is that it really brought home that obesity is a serious condition. Of course, the greatest risk factor for bad outcomes with COVID is age. Older people are more likely to require hospitalization, to require mechanical ventilation, or even to have increased mortality, death. So at every age, we discovered that the higher the BMI, the greater the risk for obesity, the greater the risk for these bad outcomes for COVID. The higher the BMI, the greater the risk for hospitalization with COVID, for mechanical ventilation being required with COVID, for death from COVID. So I think what the COVID experience has done is it's really brought home the message that overweight and obesity can be serious medical conditions.
Yes, I totally agree with you, Dr. Ryan. It was unfortunate that it took a pandemic to essentially open a lot of eyes for us in healthcare to recognize this relationship of obesity with other health conditions. Again, going with the theme that we've been talking about, this is another process of inflammation with COVID-19. It's an infection, right? And here we are with seeing those living with overweight or obesity being more at risk. So it was definitely a difficult period, and I'm hoping that from this experience, we're going to see more and more attention to address weight with our patients.
And so, Dr. Velazquez, we have two things going on here, right? First, do you find that everyone makes that link between weight and their health? And second, what can we do about that link to help people with their health?
For some people, I think that it may be a coping mechanism because it's hard to think about these type of things. And when you start to realize that maybe your health is at risk, it can be essentially a way for us to protect oneself, to not really accept that. And it may take time to come to terms with the fact that our health is connected with our weight. And when that person is ready to understand that or make that connection, or we help them, which is very important from the healthcare provider side, that we are there on their side as a team member, then we need to be ready to work with them when they want to start to work on that aspect of their health.
That's right, Dr. Velazquez. It's also important to know that you do not have to achieve a so-called normal weight to get a lot of health improvement with weight loss. Oftentimes, people will try to lose too much weight when it only takes lesser amounts of weight to really get a lot of health improvements. Weight loss has such great power. Even losing 5% or 10% of your body weight can result in dramatic health benefits, especially around diabetes and how we're feeling and functioning. So for somebody who weighs 200 pounds, losing 10 or 20 pounds can really have a dramatic benefit in terms of health. It doesn't take getting to that so-called normal body weight. So the pathway to weight loss can be varied. It may include lifestyle changes to physical activity and exercise. It might be a diet plan. It might be joining a support group with talking to other people. And it might also include medications. For severe obesity with serious health complications, surgery may also be an option. So your treatment plan could be any one or any combination of these, and it's going to be individualized for you. If you need to lose weight, your doctor will talk to you about how much. But it's really about health improvement. It's not about pounds or inches. It's about the relationship between your weight and all of these health conditions that we talked about. And losing weight is the way to improve them. It can all be a bit overwhelming. So it's just going to be about trying to reduce your risk of these other conditions and finding the right balance for you. We're learning more and more about how your weight can affect your health every day. And so we want people to be educated about it. And we also want people to feel comfortable talking to their doctors about it.
I agree. I think you made some great points. And I want to summarize by saying that I hope our listeners today really understand that obesity is a chronic, long-lasting medical condition. And ultimately, it's a disease, but it's not a disease of lacking willpower. It is a disease that is truly a cellular process involving inflammation, and it's a cascade that is very hard to get back into our balanced energy regulation. And as a result, I want people to understand that it's hard with just diet and exercise for us to be able to get our system reset and for our body to understand that it shouldn't be at the highest weight that it's ever been at, which we call, again, the set point. And many times, diet and exercise will not be enough to move that and to keep it at a lower level, which would help to improve the weight-related medical conditions. And as a result, that means people need to look into and consider other treatment options in addition to diet, exercise, healthy life behaviors. And that's where I really hope that folks today are feeling empowered to talk with their healthcare providers, with their family, with their friends, coworkers, with everyone to discuss and hear and understand that there are treatment options and that we want to help individuals to be at their healthiest place that they can be. And so that they bring this up with their healthcare team and hopefully can get the right treatments for them.
You're so right, Dr. Velazquez. It's so important for patients to understand when your doctor is discussing your weight with you, they're not judging you about your body size. The doctor is looking at weight as a way to improve your health. More and more doctors are getting interested in weight management and are getting trained in weight management. This hasn't always been the case. Fortunately, good medical management can help with weight management, and we're more likely to see health benefits when we're more effective with weight loss. Dr. Velazquez, thanks so much for joining me today. This was really great, and thanks to our listeners as well.
Thank you. Thank you, Dr. Ryan.